Let you know how things are looking.
Weather radio, check. Fresh batteries. Cell phone, make sure it is charged.
Team coverage before, during, and after the storm. You can count on Channel 3 Storm Alert Weather.
October, as you know, is Breast Cancer Awareness Month, and we're so happy this morning to welcome Katie Viola, who is with Erlanger Health Systems. Brittany Glass is with Universal Surgical Associates. Good to have you both this morning.
Thank you.
And y'all have teamed up because always we're talking about the importance of getting mammograms and preventive screenings. But this year, Katie, you kind of have some exciting news that you're bringing to Erlanger because you're having an IQ test of sorts. It's not a mental IQ test, it's more of a physical IQ test.
So it's called Cancer IQ. It is a program that is ran through our breast center. So when you come in for your mammograms at Erlanger East, you will be asked to fill out a survey on an iPad. This survey asks about your personal history as well as your family history, and it takes into account NCCN guidelines, which is what we cover for genetic testing and treatment, and looks to see if you are eligible for MRI screening, which is a high-risk tool that we use for breast cancer screenings. It also looks to see if you would meet the criteria for genetic testing related to a history of breast cancer, breast ovarian cancer, or Lynch syndrome, which is a colon cancer syndrome.
And that's where you come into play, Brittany, because once that form is completed, if there is something that they discover alarming, women are sent your way. Is that right?
Correct. So if they meet criteria for genetic testing and or high-risk screening, I'll see them in consultation. So we usually start with genetic testing. So this is women that may have a first or second degree relative that had breast cancer at a young age, so meaning less than age 50, a male relative with breast cancer. So there's certain criteria, as Katie said, the NCCN guidelines. So if they meet criteria for that, we'll discuss what's involved. It's usually $100 or less with commercial insurance, but the patient will not pay more than $250. So $250.
I think I used a word incorrectly because I mentioned if you find something alarming, then you send it your way. The truth is, even though we don't have a cure, sadly, for breast cancer, the treatments have just continued to improve, and so no one ever wants to hear the diagnosis, but there's hope.
There is.
Correct.
And that's why yearly mammograms are so important for women. Even if you're at average risk, the majority of breast cancer is sporadic. It just happens. It's not necessarily tied to a genetic factor. But those yearly screenings are how we find stuff early. Obviously, if in between your yearly screenings, doing your monthly self-breast exam is extremely important, because if you feel a lump or bump that was not there, you need to contact your doctor and you need to be screened. Catching it early is important.
We were having a private conversation, just a fun conversation earlier, and some celebrity talk kind of came up. So the power of celebrity spokesmanship is a great thing. Angelina Jolie, of course, made headlines with her preventive steps towards having her mastectomies. But if you're a young woman, Brittany, if you're in your 20s, do you really need to be that afraid? Because you might be too young to be getting a mammogram, but should they still look at the screenings?
Right. So with Cancer IQ, it's just getting those women that come in for their screening mammograms. If you have a problem, it will sometimes capture those women less than age 40. So I sometimes see younger women, or if they have a family history, their mom may have had breast cancer, I see them early. But we do not start mammograms till age 30. Even on high-risk women, so those that may have family history. So we talk about their options, and sometimes adding in breast MRI as well for those women.
I was about to ask you about the MRI. What does that do? You said it's a more sensitive test.
Correct. So it's a different way of looking at the breast. There's actually no radiation exposure, so there's a slight bit of radiation exposure with mammography, not a ton, but with MRI, no radiation exposure. It's just, like I said, more sensitive. It looks at the whole breast, and they're able to find things if something's hiding in there for those women that have denser breast tissue and or family history that puts them in that high risk category.
As a nurse navigator, you are really helping them find their way through the whole process, right?
So after they fill out their survey in the breast center, it gives us a report immediately. We look to see if you're at average risk, then wonderful. We want you to keep going with your yearly mammograms and your self-breast exams. But if you are at an increased risk, either related to genetic testing or to the MRI eligibility, we navigate you to that area, to Brittany, to do genetic testing, whatever that case may be. And I want to say that on the younger women, even though we are not catching them at a younger age right now unless they have that problem, that's why it's extremely important for them to do their self-breast exams. We do see women in their 20s with breast cancer. So make sure you know your family risk and talk to your doctors about that.
And the numbers are still, is it 1 in 8 women?
And to put that in perspective, that's if we all live to the age of 80, that 1 in 8 of us would get breast cancer. So you're at 20 years old is not 1 in 8. But as we age, our risk increases for breast cancer. So that's where that 1 in 8 comes in.
Okay, so essentially when you go in for your yearly screening, you don't really have to do the thinking. They're doing the thinking for you. If you'll just complete the cancer IQ survey, if you will, the questionnaire. But they can only do that at Erlanger East.
For now, it is at Erlanger East. We have discussions on moving that out and branching out, but right now that is where we are located with the program, getting it up and running.
And it's a brand new program, just here for 4 or 5 months. So if you want to learn more, you can go to erlanger.org/pink. You can also give them a call at 423-778-PINK. That breaks down to 7465. Thank you both so much.
Thank you.
Riverfront Medicine DPC provides timely access to your doctor, low-cost